Currently with one other particular doctor, I'm leading the COVID-19 team, which is working in the hospital. We're taking care of patients, not only in the diagnosis process, but also we're taking care of their admissions and their contact tracing, along with home isolation, updates every day that we follow through. We are a very small number of doctors and staff in the hospital, but we're quite dedicated. It's a very hard thing to do, but it is something that we're trying and striving to, get better at and help out with the people. When this started out somewhere in January and February, when a lot of people were not understanding it, we took the initiative of going to these companies, including factories and offices, and we told them what this disease was and what to look out for. We told them about hand hygiene because that's where it usually ends up spreading from your hands, and told them about social distancing. We took the effort of physically visiting these units, some of them very big factories, where we actually went and talked to the workers in their language because we didn't want to have any language barriers. So there were a lot of people who would speak Hindi, so we had to communicate with them in Hindi. A lot of people in English, a lot of people in Arabic. Luckily, because I could speak all three of those languages, I did end up having a good communication with these people. And a lot of people did understand and listen, but a lot of people were still hesitant and were not believing that this is something that could happen. It was finally classified as pandemic, and it was something that we had to now deal with as a community. There were still things that the general public didn't understand, and they're going to the wrong sites or wrong places for information, like their WhatsApp groups or on Facebook. Thank God, right now, at least Facebook has done the process in which if there is some rumor or some post which is not true, that it actually tags it and tells you that it's not a true post. But WhatsApp doesn't have that facility, so people who are in communication with their countrymen from other countries like India, Pakistan, Bangladesh, they're believing their people a lot more, although the disease, the process of control and everything varies from country to country. They should follow through with the country's rules because the ministry and the government of that particular country has prepared itself in that particular manner to control the pandemic. Once the numbers started to rise, and when we had the first announcement saying that it's a community transmitted disease now, initially there were travelers that brought it in and this and that, but at this point when the announcement was made that a person from the community has given it to somebody else and they have spread it other places, that is when people started to realize that this is something that they're going to have to take care of. And obviously when that happened, all of these WhatsApp messages regarding green tea and ginger and sanamaki and all of these other herbs and vitamin C, forwarding these messages to all these different groups, and what could have been just a small misinformation ended up being a completely big rumor. And people respond in times like this differently. The psyche, the psychological effect on a human being when they hear that they are in danger, the way they act is sometimes rational but mostly irrational. They will not be able to calm down and collect their thoughts and figure out that, okay, this is something that we need to address in a proper manner. We need to certify that the source is proper or the information is proper. No. And certain people will do it out of goodness, that, okay, maybe this will help somebody else. Certain people will actually do it that they want to be the first one to send the message across, and they don't want to be they want to be in the limelight. As the numbers keep rising, as the number of deaths keep rising, as the hospitals keep getting saturated, people panic more, and some of these people who have actual issues with anxiety will end up in the hospital when they don't need to. We have actually classified hospitals into red zones. So according to the WHO, there are three different types of zones. There's a green zone, which is your home environment. That's the safest place where you can be. There's the red zone, which is basically hospitals and any public places where there is a large number of gatherings, like airports, restaurants. Then there is a in between there. There's a go in between. It's called the orange zone, and these are places like work environment, offices, factories. The number of people is not too much, but it is still something that you can get, diseased, a place where you can get diseased. It is taking a toll on their psychological health, mental health, and they're flooding the hospitals. And I was working last night, and 90% of my patients that came in were all anxious because they read on the Facebook page or on Google or on WhatsApp groups that breathlessness is a symptom for COVID. Breathlessness comes much later. There are so many things that happened before, but that one word that triggered their anxiety, that they can't breathe, it kind of gave them an anxiety attack. And everybody knows in anxiety attacks, you do get breathless, and the more you stress about something, the more you breathe. I sympathize with them. Mental health is something that is there, but at the same time, I'm scared for them because we're a place where we're testing patients every day. There are so many we've tested positive. There's so many patients admitted in our hospital now. Staff is really overworked. They wear this suit to see these patients in the ward, and they cannot go to the bathroom, they cannot have a drink, they cannot eat for 8 hours straight. Sometimes it takes longer, so obviously their health matters too, but with the limited number of people that are working for you, and they want to help out as much as well, but there are limitations, there are things that they can't do also. With the health sector, it's different. It's not, if you ask any doctor, any nurse about this movement, not all heroes wear capes. We really do not care. We do not understand that. Frontline workers, what frontline workers? This is something that we've been doing for years. It's not something new. We've been doing this. I've been doing this for 17 years. What frontline worker? I don't get it. The patients, we get pulled. We're like, okay, we need to help them out. We need to do this. It's not something which is like, oh, frontline worker. No, this is what we do. This is normal. Yes, I do appreciate that you appreciate me, but clapping and all of that, it doesn't help me. What helps me is you listening to me. What helps me is you listening to the Ministry of Health, your whatever department, CDC, whatever it is, whoever is issuing notices in your country, listen to them. Don't create rumors. Don't say it's a hoax. Don't say it's a money-making process. It's none of that. It is literally about lives. It is about people. One of the doctors wrote in one of the groups that the fact that my safety depends on somebody else's common sense makes me very uncomfortable. I completely agree with him. We are in the thick of it. For us, it's much different. For us, it's for the doctors and nurses, it's very different. On one hand, there's this calling, that this is what you've done all your life. This is who you are. This is what defines you. We cannot get rid of this disease for a while. We will be living with this for 2 years, 3. If we don't come out with a vaccine, we'll be there for a much longer time. The economic impacts, the social impacts of this disease, the mental health impact of this disease on people is going to be massive. So the work environment has changed quite a bit. The part of the hospital which is COVID is completely separated from the rest of it. The elevators used for it, the staircase used for it, the nursing staff used for it. And because of this policy that every staff that ends a shift of 14-15 days, they stay in the hospital, they don't go back home. They then further stay 14 days into isolation. That's a good 28, 29 days, a month long that they have stayed away from anybody, and they stayed within the hospital facility so that they don't pass it along to their family. And then what happens is, once they come out and they're okay, they don't need to be tested until they're symptomatic. They obviously, the stress that, God, if we get infected, what's going to happen then? If they're lucky, they'll go back to their regular duties and other wards. If there is a shortage of staff, this staff will re-rotate into the COVID ward, and now it's going to take him 2 months before he can see his family. We have nurses that have not gone home in 3 months to their family. Like, they're living here. These are real people. I haven't hugged my wife in 3 months. She wants to sit down and talk, and I want to run away. These are real things. That's the part you don't see. So one of the staff has been in the hospital now for 4 months. His family lives here, his baby lives here. He hasn't seen them in 4 months. It's for their safety. He understands it's about video chats. He's got used to the video chat facility. He sees them on the video chat every day. Everybody, all the doctors, they're super cautious. We're not sitting and having meals with our families as much. If we're coming down to meet our family within the same house, as if somebody will come from outside, no, within the same house unit, we will wear a mask because we're not sure about us. We're completely unsure. There is so much knowledge that a healthcare worker acquires about a disease that he is paranoid about everything. Before COVID-19, we were a very active family. Barbecues, poolsides, seaside, mountains. We love driving up the mountains, and we're always out and about doing something. And obviously, we were very close to nature. We don't like city life as much. So every opportunity we got, we would be out. And it has stopped quite a bit now. We can't go out. The only person leaving the house now is me. Everybody else is stuck at home, whereas I go out every single day. I think I'm a little sane. I still interact, right? I have somebody to talk to. At home, these guys are stuck, just like everybody else. And it takes a lot of emotional toll on a human being. It takes a lot of toll on not just the mental health, but physical as well. You'll see some of the people who are okay with staying home will be gaining weight, but the people who are not, they're losing weight. It's all stress. You'll notice that these people who are genuinely unhappy about like staying home, but some of these people are actually loyal to the word of the government and the authorities, and they stay home. Others just don't listen. The numbers keep rising because of people not listening. There are multiple aspects in this society. I know office workers that don't want to go to the office, but the management forces them to come over. They know they have positive cases inside. They have isolated them. There is a danger to them, but they're unwilling to budge. They told them to cut down to 30%. If you have a population of 10 or 15 people in the office, work cannot go without them, so they're not cutting down. The concept of working from home might be okay in the West, but in Asia and the Middle East, it just does not exist at the moment. They are forced to come to the office because their bosses don't trust that they will be able to work from home. They're being forced to come into an environment and cause these problems to themselves and their families, because a single person in a unit getting infected means everybody else who's in contact will get positive. We have tested numbers after numbers in factories positive, because the factory was unable to put down the measures because their production output and then breaking even of the finances was hurting them. There's a scale, and on that scale there are finances and then there's human life. And this time around the human life has not won. Finances have won yet again. It is always about the finances. Finances will always win. They're being forced to do things that they shouldn't be. The companies could cut down on their profits. No. There are people working with 30% salaries. There are healthcare workers, doctors working with 50% salaries, being forced to go into COVID situations every single day, watching these patients every single day and not getting paid. The non-medical administration of hospitals says, oh, these are testing times, it's a national emergency, we need to help out the country, whereas the motives behind it are very different. The motives behind all of that is just, oh, maybe if we can make a little extra buck here. Finances will win every time and humanity will not. It just is a rare thing to see. Maybe certain companies have worked hard in making sure that finances don't come first. There are people that have stepped up and they're doing their part. But not everybody is. And those people who are selfish like that and not doing their part, they are concerned with finances and people coming into the office, or, oh, we don't care about the masks or gloves because it's okay. They're playing their part of destroying this world. Nothing we can do about it. You cannot change the nature of man. When COVID-19 started coming up really early up, me and one of the senior anesthetists in the hospital, we decided that, okay, we have to be prepared. The government had not sent us the policies for the changes at that point. We were about to receive them in a day or two. We were people who had studied epidemiology and we had gone through certain infectious diseases in the hospital settings in the last 17 years that we've been working. And we kind of realized that, okay, before anybody else takes an initiative, we might as well do it. We isolated parts of the hospital completely. We used false partitions, plastic partitions. We set up a help desk in the front. When the government policies came, they were pretty much identical to what we had done. And we were quite happy. And we were very happy that because those policies would not just safeguard the population around the community, but it will also safeguard the healthcare workers and the people who are working in the hospital, whether it's in the finance department or it's the insurance department or the radiology, anesthesia, operation theaters, whichever department you're in, it'll safeguard. Those policies are very important and they do help out. Nursing staff are the backbone. They do everything that everybody else doesn't do. Those people are suited up every day. Going in, they make sure they have their breakfast, they're all filled up and everything else, and that's when they get ready. They have a separate room where they go and change. They suit up completely, and from that point onwards, they cannot use the washroom facilities. They cannot use anything else. They can't drink. They can't eat. They're taped up, and they take care of these patients for as long as their shift lasts. Then the second person comes in, and the whole process starts again. For the doctors working in emergencies, like me, we have very minimal protection that we use. We don't use the whole thing because PPE itself is very precious. We go there, our desk unit, everything else in that room has to be completely sanitized, regardless of the fact that it was sanitized the previous shift. We have to do it again. Why? Because it's safer. It takes almost half an hour to clean up everything. There are cleaners that we have trained how to do that, but once they are done, we have to do the desk unit and everything else, the chairs, because the policy that we have set up is that everybody walking in is positive, symptomatic or asymptomatic. That's the only way you're going to be able to keep a safe enough distance to prevent you from getting sick and then passing that sickness along to your family and to your patients. So our days, our way of thinking, our approach to everything has changed. One of my doctors lives in the house with a wife and 2 kids. The wife is still in touch with him on and off. They get in touch, like, they sit in one room and they talk. But kids, no. Strictly prohibited to get in touch with his dad. He hasn't seen his kids in 2 or 3 months now. They're waiting for a repatriation flight so he can send his family back home, so that he can at least work a little more freely here. A lot of doctors will not have the opportunity or ability to isolate their family. Every member of the family that we have tested that has come out positive, any patient that came out positive, his wife and kids were surely positive. I have not come across one patient where a wife or a child was not positive because the husband got positive. Now, of all the things, other than the fact that people are getting positive from not caring, there is something called overcaring, or a false sense of security. It's like a false sense of security that also gives them positive results. One patient came in, mask, he's been wearing for 3 months, working from home for 3 months. His boss was very good. So this guy was working from home, his wife had not gone out anywhere, kids did not go out anywhere. He was super vigilant, but he came with cough, runny nose, and a fever and severe body aches. Obviously, according to the policies that we've made, he fell into the category where he needed to be tested. And we did test him and he did end up being positive. So once a patient comes out positive, there's a process of tracing contacts. We have to trace everywhere he has been. Once we retraced his steps, we figured out that 5 days ago he went to the supermarket. Now, this guy was super vigilant. He was wearing gloves all the time, whereas if you look at the website of Ministry of Health Oman, it actually tells you not to wear gloves. It tells you to wear masks. It tells you to wash hands and sanitize hands. Wearing gloves and then going in and touching your phone, driving your car with it, touching everything in the supermarket. This guy got positive from there. We don't know exactly which aisle, which supermarket, how it went to, but he got it from there. He couldn't believe it. He's like, I'm super vigilant. I would wear gloves all the time. So I asked him, when you were in the supermarket, you picked up your things with the gloves and everything else, there was a list. He's like, yeah, it was on my phone. I'm like, did your wife call in between and say, oh, don't forget this? He's like, yeah. I'm like, did you take off the gloves when you went into the car? He's like, no, I drove with the same gloves. I wanted to be protected. This false sense of security got him into this mess. Now his company called us and they said, okay, we're isolating him and everything else, but we want you to test his family. We told them that if they're not symptomatic, we will not test them. They were adamant. They contacted every person in the top management, this and that. You have to test them. We sat down and we tried to explain to them why they shouldn't be tested. Because if they are, they will develop symptoms later on, and if they come out negative now, they will come out positive later. In between, they contact anybody else and they're not isolated, it's going to be a problem. For them, the rule is isolation. It was so hard to explain to the general managers and the CEO why we don't need to test them. They paid for it because there is a paid facility available, and they said, we will pay for it, you test everybody. We did test everybody, they were all negative. And they're like, oh, thank God, we're fine. Oh, everything's going to be fine. 3 days later, the wife was the first one who fell sick. 2 days later after that, the 2 kids. They came back, retested, this time positive. They had the virus before. The people just do not listen to doctors. They just think they know better. It is so hard to explain to them what a 14-day incubation period is, how it works, what happens. So hard to tell them. There is no takeaway message other than the fact that you need to be vigilant, safe, and follow the guidelines that they have laid out for you. Not everything has to be about a fine. If they would have listened in the beginning, we wouldn't be in this situation. Why is it that we have to force fines? We have to publish in exact manner. You can wear a mask now, but not now, like this, but not like that. Why do we have to do that? Comes back to the same thing, that my safety depends on somebody else's common sense, and that doesn't make me feel very safe. If somebody tells you that you're doing something wrong, don't feel belittled. Don't. Actually think that they're doing it for your benefit. Stop looking at your WhatsApp group. Stop looking at Facebook. Go to the ministry websites. Go to WHO websites. They'll tell you what it is, how it is. There are people that have died in hundreds of thousands of numbers now. They're rising every day. Millions are infected. Number is still rising. We just need to obey. We just need to obey for a little while. The longer you disobey, the longer this thing continues. There are countries that obeyed and are actually COVID-free now. They listened, and they're perfect now. Let's be one of those countries. Let's be one of those countries that can actually do that.